Well, we actually have Amber Miller, the marathon mommy herself, on the phone with us. Welcome, Amber.
How you doing?
Hi, doctors. How are you?
Good. How's the baby?
Oh, she's great. She's sleeping right now, so that works out nice for me.
Oh, that's fantastic. Now, how did you feel running this race?
I felt pretty good. This is actually my 8th marathon and my 3rd marathon pregnant. But this is definitely the farthest along I've been pregnancy-wise running a marathon.
How far along were you, Amber?
I was 38 weeks, 5 days.
Woo, that's pretty
Now, some people say running a marathon is extreme, but running a marathon 38 weeks plus pregnant, that's pretty extreme.
But you did great, and you were a runner before, and she did the things of trying to stay hydrated because you want to make sure you don't get too dehydrated. You don't want to get too much sun and get overheated. You want to make sure you can talk because you're breathing, mommy's breathing for a baby.
Now, Amber, were you cramping at all while you were delivering? I'm just like picturing a hamstring start cramping.
You know what? Actually, all those endorphins, they say actually if you exercise and you do more of that, that's going to help with labor and actually make labor go faster. So again, as obstetricians, we don't encourage women enough to exercise. The benefits of exercise in pregnancy, it decreases gestational diabetes. It helps with a lot of things. So, and women getting overweight.
26.2 miles?
No.
Wow.
That's where the question comes in because that is considered maybe overexertion. Most women are going to push it a little bit too far, and that's where it becomes a problem.
But Amber, thank you so much. We're so happy that you're healthy, that your baby is healthy.
Thank you. Thank you for having me on.
So this is something you should never do without your OB's approval.
Always, before you do any exercise, you actually have to consult your OB because there are, contraindications to exercising if you have certain problems like incompetent cervix, preterm labor, preeclampsia. We do know that running is not much different as far as impact from going downstairs. The problem is with the fact that a woman's center of gravity gets off as she gets further down, so the potential to fall is an extreme problem. And also the joints, the laxity of the ligaments. So down the line, she may have more problems because it's like 100 times more pressure between the weight and the laxity on the joints. And again, the breathing, and with the marathon, you know you're gonna push yourself to limits. So it
sounds to me like you're obviously being respectful of Amber's choice, but
consult
we
your
both think
doctor.
this is a lot.
This
is probably a little too much for almost everyone.
Almost anyone,
but
yes.
Go ahead and be active during pregnancy. Discuss it with your
healthy.
doctor. It's good for you. It's good for the baby. Just maybe not 26.2 miles.